Great. So I'm Anna Campbell, and my background is actually immunology and biochemistry. And I worked in the biotech industry for a lot of years. And some of you may remember Dolly the sheep, the first cloned animal. So I worked with Dolly. That was my background in transgenic technology and cloning. However, about 20 years ago, I did a master's in sport and exercise just because I was interested in being active and how it affected your body. And my friend who was a breast care nurse 20 years ago said to me, Anna, I tell all my patients while they're on chemo to stay in bed, rest, don't move. Is that the right thing to do? And at that stage, I looked at the literature and there was virtually nothing about cancer and exercise. So that's when I started doing the research into it and got involved in a couple of clinical trials. One of the biggest ones I got involved in was looking at what happened if you exercised when you're in the middle of treatment for chemo, for breast cancer, so in the middle of chemo radiotherapy. I did a group exercise where in Glasgow, all the councils had various gyms, and we invited the women to come twice a week in the middle of the chemo radiotherapy. And then we monitored to see what happened to them as far as physically, their ability to get on with their daily life, their cardiorespiratory fitness, and qualitatively, how much they felt their quality of life had changed, their fatigue, etc. And that was way back in 2007. And the results showed that, yeah, it was feasible. A lot of women in the middle of chemo radiotherapy were happy to stay active. They loved the group, the fact there were other people that understood how they were feeling, and so they didn't need to explain themselves. And also it improved their quality of life. There's how much activity they could do. And we followed these women for 5 years. And because it was a proper trial, 100 of the women didn't get any exercise and 100 of the women did. And the 100 of women who did get the exercise, even 5 years later, were doing a lot more activity than the ones who hadn't given that little 12-week program in the middle of chemotherapy. So that was showing that, physical and psychological benefits, both short-term and long-term, could be given if you had the appropriate advice to help somebody to become or stay active and help them maintain that, or help them keep that behavior long-term. And from a cost benefit, this was what we did was we showed that actually this little 12-week program only cost them like £300 or £400 for the venue, the training, the equipment, but it was saving the NHS about, I think it was £3,100 per person, because the women who were being active had less nights in hospital due to neutropenia, and they had less visits to the GP. So that was what started me in showing that this is something. Now, as far as the evidence, it's got much more complicated and wide about why it's so beneficial. I mean, one of the biggest bits of new evidence that's come up is that people who are active during their chemo tend to actually get the full dose of chemotherapy that's recommended to them. So a lot of people who are not active or sedentary, for whatever reasons, they're not getting the complete dose. Either they have to get the dose reduced, or they're missing more of the cycles of the chemo or the radiotherapy that's recommended to them, whereas those who are given an exercise program. The second thing is the new evidence, if you're active while you're on chemo radiotherapy, it gets into the tumour better. So obviously chemo and radio are trying to kill right in the tumour. Tumours are actually quite hypoxic in the centre, so they don't have a lot of oxygen. So they need things like activity to push that drug to get into the centre of the tumour. So these are new areas where it's showing that actually there may be some reasons why people are active during and after treatment, their long-term survival disease-free seems to be significantly higher than those who are completely sedentary. The other reasons that it can be beneficial, and this is for me thinking from a kind of cellular physiology perspective, is that it boosts your natural killer cells, and they're the main cells that go around your body killing any rogue cells that are not looking right. So it boosts your immune system, it dampens your inflammatory markers, and again, cancer cells thrive on inflammatory markers. It also, if you keep your exercise and diet right, you're reducing the amount of body fat, because body fat, again, is the area that cancer cells thrive on. So exercise and diet definitely helps to keep that weight off if you gain weight, which is quite common, particularly with breast cancer. Most women gain about 7 kilograms. And I was involved in a clinical trial where we did diet and exercise, and we showed that that kept that weight off, cholesterol levels were good, insulin modulation was good. So keeping that in mind is quite important. And interestingly, that study, we did the 5 and 2 diet. So women in the middle of chemotherapy were given 5 days eating normally, 2 days restricted calories, and that helped them reduce the kind of weight gain that was normal and kept the physiology pretty good there as well. So there's lots of kind of mechanisms, and definitely exercise and being active helps protect you from cancer recurrence. There's a couple of big studies that are ongoing, big randomized control trials looking at prostate and colorectal, where we'll find the evidence where they have done a kind of randomized control trial, but that's going to take a long time to get the numbers. There'll be another 3 or 4 years. But there's other things, even with advanced cancer, where they show that those who are active, the disease-free survival, or they live longer than the ones who are inactive, and that's been shown with brain tumours and lung cancer as well. But the big areas where the evidence is stronger is that if you're on treatment, one of the main things that happens is one of my colleagues who worked for NASA showed that people who do nothing during chemo tend to lose all their muscle mass as much as a spaceman in space for about 9 months. And also your cardiorespiratory fitness, if you do nothing, ages you 10 years. So you are almost 10 years older cardiorespiratory fitness-wise if you were to do nothing. So anything that you do stops that decline being as bad as it is. And that's where the evidence is the strongest, that by doing some activity, and again, it is where you are in your cycle. So it never is with any of the CanRehab instructors. We never say, by the end of your chemo, you're going to be stronger, you're going to be fitter, you're going to be faster. What we say is, we will stop that decline being as bad as it would be. But within that, there's going to be weeks where you can't lift your head off the pillow, and there's going to be weeks where you can maybe do a 10, 15-minute walk. So it's not incremental improvement all the time. It's tailoring it to where you are each stage. But once the cancer treatment is over, that's when it's time to say, okay, how can I continue my activity? How can I do? And there's 3 main components you need to think about. Heart and lungs, which is your aerobic. And, one of the best things you can do is just brisk walking. And that way walking has to be not a little stroll as if you're going around the shops looking like that's a nice dress. It's got to be where you feel as if you're rushing for a bus, you're just slightly breathless. So whatever that is for you is the level, but not actually where you can hardly breathe, where you're really struggling. That's not what you want. So that's the aerobic component, which is important. And the second one is our muscles. We need to keep the muscles strong and our bones. So anybody who's on hormone treatment or has been pushed through the menopause, anything like that, where you need to be doing weight-bearing exercises. So that means, even just if there's a little step, if you were to jump down that step, that weight-bearing, or if you're at the wall and you kind of push away from the wall and then go back to it and push away, those type of impacts are actually strengthening the bones. So that's something that is quite important, and keeping the muscles strong. And as I say, you don't need to do bicep curls, but it's even just anything like sitting to standing, that type of thing is actually strengthening your bones. Sit-ups, lunges, squats, anything like that from a seat is really good. And the third area is range of movement. And again, this is something that if you've had scar tissue, sometimes if you have a radiotherapy or surgery, the scar tissue pulls that part of your body where you've had the surgery together, and it means the range of movement isn't so good. So whether it's abdominal surgery or surgery around the neck or breast or underarm, trying to keep that range of movement is very important. And also balance. As we all get older, it's really important that we do little balance things like hold on to a chair and try and lift one leg up and see how you get on. If you can do it without the chair, even better. And the hardest is actually to do it with your eyes closed. But these are all quite important things for keeping our balance. And yes, they are important for all of us, no matter what. But with people with cancer, it really is quite important that these kind of activities are done. Because other side effects, I've mentioned, reduce the risk of lymphedema. It helps reduce chemo brain. It reduces peripheral neuropathy and that numbness and tingling. If you get any problem with hormones and you get numbness or stiffness in the joints, again, the evidence shows. Is that a cup of tea for me as well, Wendy? So, yeah, there's lots of side effects that we've now analysed and shown that are benefits. So it's not only just the big ones. The big six where the evidence is strongest is quality of life, fatigue, muscular strength, aerobic, depression and anxiety. So I think that's a kind of quick review. I really would just like you to ask me any questions that you have about any of the evidence or advice or anything that's out there, because SafeFitTrial, I don't know if any of you are aware of the SafeFitTrial.
No, I don't know.
So this is a free trial where I'm involved in, where anybody who's been affected by cancer get 6 months support with a qualified CanRehab instructor who's a qualified cancer exercise specialist. And you also get support with any emotional issues, and they're also trained in nutrition. So for the NHS are funding this, so they would actually meet you up to 3 times a week for the first month, and then once a week for months 2 and 3, and then once a month for months 4, 5, and 6. And we've got a clinical advisory group who make sure that anything that there's any issues that need to be questioned. So it's a proper trial. So there are questionnaires at the beginning and questionnaires at the end. And the end result that we're hoping is that we see that people who've been affected by cancer, they're working with this CanRehab instructor remotely, that they get effects, and that the NHS should provide this as part of a standard service with these instructors. So if anybody has been on it, how have you found it so far?
I'm just starting this week. So I've had my first session with my instructor, which was a talking session. And my first exercise session is this afternoon, starting at 4:30. So I'm looking forward to that. She's a yoga qualified instructor, and yeah, she's going to do a mix of yoga and Pilates and exercise, muscle strengthening, and so on. So I'm really looking forward to that.
So any of you, I mean, it's almost like having a free personal trainer for 6 months. Wendy, were you going to ask something?
How does one join this?
I'm going to put it on the chat, the website. You just self-refer and they will get you a person. So it's SafeFit.nhs.uk, www.safefit.nhs.uk. And anybody who's been affected by cancer, any stage, any age, ability, our CanRehab instructors are qualified in lots of different things. So we've got some that maybe specialise in people who may be able to get cardiac issues, or we've got somebody who specialises in working with people advanced in palliative care. So we've got oncology nurses who are instructors. We've got a huge variety, and so we match people.
Oh, so you do match people? That's what I was about to ask. Do you match people? Because I can get a bit complicated, a bit like Wendy, I think.
Well, yeah, absolutely. And we have a team. So there's nobody that's too complicated. I guarantee you that. There's nobody that's too complicated. And we match, not geographically, but match, you know. So, I mean, your CanRehab instructor's probably not round the corner from you. She or he will be men and women. So we do try and match them. Like we've got one man with prostate cancer who cycles about 100 miles a week. So we've got a triathlete guy who's very into cycling who's matched with him. So, and we've got others, I say, people who are advanced, very advanced cancer, and we've got excellent instructors who are much more into gentle movement, Tai Chi, but also nurses or physiotherapists that can tailor it specifically for their needs.
I wish I had known about this earlier on, because in my case, I just give you a quick example. People like Kay know about this, but I was told, right, when you've had this operation, it's advised to keep walking. Now, I love walking. I always do 5 to 10 miles a day. And I just thought, oh, right, I'm off. And now what I've done is I have actually damaged myself, because they turned around and said, well, we said walking. And I said, well, yes, I walk. I mean, I didn't do that. I mean, I graded it very carefully, but I was quickly up to my 3, 4, 5 miles. And they said, but we meant a trot up to the road. And I hadn't understood that. And they said,
it does actually help if they tell you exactly what they want you to do rather than go for a walk, isn't it? It does help.
Well, yes. It's I'm not criticizing. It was me being stupid. But I thought I had explained that I do walk, and I just thought, oh, whoopee, I can go back walking. And then, of course, 3 months later, I was back home to have a scan to see if I'd damaged.
Yeah, and that's what we find with a lot of health professionals, and that's one of the main roles I'm trying to do with CanRehab is train health professionals, because a lot of them don't know where the evidence is and they don't know how to advise. So it's almost like giving them the basics and then saying, right, you need to refer them to an instructor who has all the information, rather than just saying, a lot of instructors or a lot of health professionals like the oncologists and nurses say, yeah, do a little bit of exercise, but not too much. I mean, what does that mean? That is just not going to help anybody.
Well, that means different things to different people, doesn't it? Depending on how.
And it depends on your baseline of where you started up from.
Absolutely. And that's where, you know, the CanRehab instructors, and I've trained now about 700 or 800, and I'm now training them in America and Canada and Spain and Portugal, because the program has been given a kind of gold standard award prize. And these instructors are trained to treat everybody as an individual, and you need to know, so there's no, you know, kind of prescription for everyone. Everybody has got different cancers, different treatments, different side effects, different other issues going on in their life. And so when they get this qualification, they've already worked with 12 different types of cancer patients, and they know how to tailor it so it's safe and effective. Because somebody who's got a stoma is going to be different from somebody who's got bone mets, is going to be different from somebody who's just finished breast cancer treatment and on hormone treatment. And the evidence and what you prescribe is different for each of those individuals. And that's where we're trying to say, and this is why the SafeFitTrial is so important, because we're trying to say the NHS is at breaking point. I just had a lovely email from an oncologist, Lucy, who just said it breaks her heart where she is that she cannot offer the treatment that people need. It's not like, I'm sorry, your cancer's come back. I'm sorry, I cannot give you the treatment you need because it's not available at the moment. It is really, really tough out there. But what we are trying to say is there are qualified instructors in the community who can do this bit. They're not expensive, but they will help make your life easier and that they can work with them. Because as I said, the more you're active, the more you don't rely on the NHS, because you've got these other support groups like you've got here, a group of people who support each other, answer each other's questions. So I had that as well. I think you should do this and do that. There's lots of other ways rather than letting hopefully the NHS go on to what it should be doing, which is more dealing with the very acute cases.
Anna, would I need to have some sort of approval to go through? I'm just thinking, even though I've been through treatment and my major surgery, unfortunately I've got more surgery this coming Monday. I'm told, hopefully it's a much quicker recovery, but obviously there's the point at which I can't do this. What do I need to be able to sign up and start if I wanted to do it in, say, 6 weeks' time or something?
Well, this would be the time to do it, because if you fill in the form now, they will probably give you a call in about 3 weeks' time, because so many people, go over 1,000 people have called up. We need about 1,500, so we need you guys to keep recommending it. But if you probably get the phone call after treatment, and that would be brilliant, because you would then start the 6 months not long after you've finished your surgery.
Okay.
And the key for you is be as fit as possible for your surgery, which it looks as if you are keeping fairly fit. So that's why the anaesthetists are saying if you can be as fit as possible before you go into surgery, you will recover faster.
Okay.
It was quite a few weeks. Sorry, it was quite a few weeks after I applied to take part in SafeFit that I eventually now started it. And part of that was that there was a really good assessment to make sure that I was going to be fit enough. And because I have the opposite problem from some people, in that I've lost a lot of weight. I didn't weigh very much to begin with. I now only weigh 7 stone. I've lost a stone, lost a lot of muscle mass and all the sort of strength and so on. And actually the SafeFit team decided that I should get approval from my oncologist before they could take me on. So it was very thorough. It took a long time, but I think it was very worth it. And my oncologist said, yes, that's great. Exercise is wonderful. Say yes, please go ahead.
Yeah.
But it does, from beginning to end, it does take quite a long time before you start.
Yes, and that's where it's safe. We call it SafeFit, particularly since it's a remote service. So we want to make sure that everybody, when we do that thorough investigation, if there's any things like, you've lost a lot of weight, we need to think, right, is exercise the right thing? We need to go back and get the oncologist or the surgeon to say, yep, that's fine, or oh no, that person can get emotional support and nutritional support, but we don't want them doing exercise. So everybody's different, as you said, and we take a very detailed, and that helps us match with the right person to ensure that your program would be different from somebody who maybe had finished a cancer treatment and put on 2 stone in weight. Their program would be very different from yours, because in yours we want to build up the muscle. So we don't want to burn off calories, making you go on a bike or go up and down steps. It'll be much more making you get more muscle mass back.
Are the trainers do they have particularly specialised qualifications to cope with cancer patients?
So the CanRehab qualification is B1, the kind of gold standard for, and what they are fitness instructors who are not your standard aerobics instructor or gym instructor. That's called a level 2. They have to go through a level 3 where they become either a personal trainer or a GP referral specialist, and then the level 4 is what we call the CanRehab instructor. But a lot of those instructors also are cardiac rehab, diabetes rehab, stroke rehab, falls prevention in older adults rehab, dietitian or nutritional, motivational, mental health. So we have on a register everybody's other occupations or strengths, so that depending on, as we mentioned, that's thorough. So if somebody's showing signs of anxiety and they're actually quite frail, as well as having cancer, they might have had a stroke, we can go through a register and match the right person to them. And we have and the people who are on the register, just to say, it's a CanRehab Trust register. So I've set up not only the training company, but the charity, which is called CanRehab Trust. And that's a charity that has a register of all instructors. And they also have to have their DBS PDG, they have to have their insurance, so they're all qualified. And they stay on the register. If there's any complaints that we look at, then they would be taken off the register. Thank God that hasn't happened. And they are geographically around the United Kingdom. And as things open up, we will probably try and offer people matching with local people if they want to meet somebody locally. But actually, when we set up the SafeFit trial, we thought we'd mostly get women with breast cancer post-treatment, but what we found is a lot of the people on the SafeFitTrial have got advanced cancer and maybe other complications. And so the thought for them of going out to local gyms is just not right. But the fact they've got a personal trainer coming in their house has been a big plus. So we actually found that for a lot of people who maybe get secondary cancers or on very prolonged treatments or major side effects and other issues as well, the SafeFitTrial has been, particularly during lockdown, has been a godsend to them. They've really benefited from it. And the other thing just to say is that I'm just back from Lanzarote, where I was with 40 Danish cancer patients. And in Denmark, everybody during treatment gets an exercise program as part of the treatment. It's not an add-on. And they every year take some people out to Lanzarote, to a big sports complex, and I go out to see them. And I ran the triathlon. We do a triathlon at the end of the week with one woman who was in her 60s with advanced lung cancer, another woman who had a brain tumor who was in the middle of her immunotherapy and chemotherapy, and another young girl who's got lung cancer as well, and another guy who had a brain tumor. And they all, at the end of the week, were like athletes. We felt really like athletes. So CanRehab Trust, I mean, we're not going to start with Lanzarote, but I might start, there's a lovely place up in the Highlands, and try and offer that as a retreat for some people who may be interested in coming, like you guys, just a group of like-minded people to do some fun yoga, walking, nutrition, etc. Because I think, again, it would be quite nice. And again, I'd love to raise money so that those who maybe can't really afford it get the opportunity, because that's what the Danish do. They offer free places for those who are maybe not as well off. So I've got lots of plans and lots of fingers and lots of different pies. I was just saying before I came on here, I'm part of the World Health Organization Cancer Rehab Group. So I was in a call with people from all over the world where we're trying to make sure that specific programs for endometrial cancer in Africa, India, Australasia, America, North, South America, we all kind of have an idea of what is essential to help somebody through a cancer diagnosis and onwards. So that's been quite interesting.
I wonder if there's any more that you could do to promote the exercise program that you deliver on the Macmillan website, because for me that was the starting point. That was about 3 months ago when I thought I can literally now barely walk across the road, whereas before I'd been able to walk 4 or 5 miles without thinking about it. And it was one of Caroline's colleagues at Macmillan who sent me a whole load of information, and the starting point was looking on the website, and I'm still doing those exercises now most days. So helpful, but I don't know whether everybody knows about them.
Wow, I mean, that's so nice, because actually I was beginning to feel a bit losing confidence, because a couple of people told me they thought they were rubbish.
Oh, no,
so thank you. I
didn't
really
think that at all.
Oh, thanks. A couple of academics were like, I don't like that move more you do. And I was like, oh, I thought it was okay. So thank you. You made my day.
Oh, good. Well, I mean, I wonder if anybody else has done those exercises in this group.
No, I haven't seen them. I felt that I had a period. So last year I had a one-sided mastectomy and a pre-pectoral reconstruction. So it was sewed onto the muscle. And so then I had strict instructions that I had to wear a post-surgery bra 24/7 for 6 weeks. And this arm was not to go above my shoulder in any way, shape or form, banned. But all I had was a leaflet of breast cancer now exercises on post-surgery movement I'd been given after a sentinel node biopsy.
Yeah.
And I was just randomly told, well, you've got a leaflet, off you go. And I looked at it and I thought, well, so many of them were above.
Yeah, they're all about these, aren't they?
And wall climbing and wing things. And I thought, well, I can't do those. So I felt really lost. And I'd say in that 6 weeks where I was banned, everything seized up. And then I saw the consultant and he said, oh, well, 6 weeks is up now, you can go above your shoulder. And I thought, I can, I have permission, I physically can't. Yeah. So the videos and your contribution has been wonderful, but I lost so much in those 6 weeks. So anything that filled that window and giving more ice has been wonderful.
Well, I can send you, I've got a breast cancer DVD as well, which is specifically for breast cancer. And it's got like you washing your windows and zipping up your zipper and picking apples. So I can, if you want to send me an email, I will send it with your address. I'll send that. I'm going to give you my email address. And the exercise for Macmillan is online. And so what I could do is, afterwards, Sharon, I'll send you the link. So yeah, it's not right. And you can share it with everybody, because it's got lots of different, it's got a warm-up and an aerobic component, it's got a strength component, and it's got a flexibility. It's in a house and it's got 3 people, so you can decide Do you want to do it sitting down like the lady? Do you want to do it like me, who's the middle one, or do you want to do it like the man who's pushing it quite hard? And yeah, so it's you know, it's not perfect. I'm not perfect as an aerobics instructor, but it just, in a way, it shows what normal people would do when they're doing these exercises, rather than being like a green goddess or any of these instructors. So yeah, and it's funny because when I meet people who have obviously done it or watched it on YouTube, they're like, "Well, you're a lot smaller in real life than I thought you were." Because I'm only 5'1", so people are like, "Oh my god, you're so small." So I'll put the, so send me that email and I'll stick, you know, one of these DVDs. Again, I'm trying to get breast cancer now to make it online, because how many people use DVDs now? Nobody. So, but they're still reluctant to do it. I'm not sure why, but that one is probably more good because I talk about lymphedema, lymph nodes, talk about range of movement, cording. So it's very good for breast cancer. But the Macmillan one's for everybody. So I'll send that link. So guys, I'm going to have to leave soon. I've got something coming up very soon. So if you get any other final questions, please ask me anything.
I don't think so. I mean, the only way to register is to go on that website that you put the link up for. Is that right?
Yeah.
Okay. So
and if you follow Facebook Facebook, it's CanRehab. I've got a Facebook page, and I put new evidence, like the new paper out about chemo brain and how exercise helps reduce that. So I'm always putting new papers out that's out there, and you know, trying to do these kind of brief tutorials. So you know, it's not for everybody, Facebook, but it might be something on CanRehab, or likewise Twitter. I've got my CanRehab Twitter. I usually put stuff. So if you want to hear, and it's all just, you know, what's going on evidence based. It's not anything to do with my private life. It's just lots of stuff to do with, like when I was in Lanzarote. You see some of the people that I was working, you know, training with, and how inspiring that was. Just little stuff like that.
Thank you.
That's been really good. Thank you.
No problem.
Yes, thank you very
Enjoy
much.
the rest